exam, it's best to inspect the breast 5 to 7 days after the onset of menses. It should be performed at the same time each month. Begin by looking at your breasts in the mirror with your shoulders straight and your arms at your hips, looking out for breasts that are their usual size, shape, and color, breasts that are evenly shaped without visible distortion or swelling, dimpling, puckering, or bulging of skin, a nipple that has changed position, or an inverted nipple, pushing it inward instead of sticking out. You also want to look for redness, soreness, rash, or swelling to those areas. Next, you want to raise your arms and look for these same changes. While you're in the mirror, look for signs of fluid coming out of one or both nipples. This could be watery, milky, or yellow fluid or blood. Next, feel your breast while lying down, using your right hand to feel your left breast and your left hand to feel your right breast. Use a firm, smooth touch with the first few finger pads on your hand, keeping the fingers flat and together. Use a circular motion about the size of a quarter, covering the entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Follow a pattern to be sure that will cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. You can also move your fingers up and down vertically in rows. Be sure to feel all the tissue from the front to the back. For skin that is just beneath, use light pressure, medium pressure for tissues on the middle of your breast, and firm pressure for the deep tissues in the back. When you've reached the deep tissue, you should be able to feel down to your ribcage. Finally, feel your breast while you're standing or sitting. Many women find that it's easiest to feel their breast when their skin is wet and slippery, so they do this step in the shower. Cover your entire breast using the same hand movements as described before. To perform a testicular self-exam, it's best to examine after a warm bath or shower when the scrotal skin is relaxed. Examine each testicle gently with both hands by rolling the testicle between the thumb and forefingers. Find the epididymis, the soft tube-like structure behind the testicle that collects and carries sperm. If you're familiar with this structure, you won't mistake it for any abnormal mass. Look for lumps or irregularities, remembering that lumps or bumps may also be present themselves as painless. Look for any changes in size, shape, or texture, remembering it is normal for one testicle to be slightly larger than the other. If you notice any lumps or changes as mentioned above, you should seek medical advice and schedule an appointment. Remember that testicular cancer can spread very quickly if detected early and is one of the most curable cancers.